Welcome back into Cullman Today. I'm Debbie Wood along with Lori Strain. Lori is the director for the Wound Care Center at CRMC. We're going to learn all kinds of great things that are actually benefiting our community as we speak.
Yes.
The Wound Care Center opened a couple of years ago.
Yes, May, 2 years ago.
Was it this month?
Yes.
Or last month, 2 years ago? What has that done for our community?
Well, I think it's helped a lot. Actually, I know that it has with preventing things like amputations, and wish you could see our lobby. We have butterflies that we have our patients to fill out just to give words of encouragement for other patients that come through.
Right.
I think most of the time when a physician does send a patient, they're a little apprehensive because it's advanced wound care and they don't really know what to expect when they walk through the door.
Exactly.
But they come in to a very friendly staff. We explain everything that we're going to do to them,
Right.
and so I need to bring pictures sometimes just to show before and after, because there is nothing more rewarding than to see people walk in through your door that have been struggling with wounds for years. Debbie,
wow.
I've had some that said they've had these wounds for 5 years.
Oh my.
And to be able to not only heal those wounds, but to educate them what they need to do to prevent them.
To prevent.
And that's what it's all about, and I'm so excited to be able to go out this week into the community and into the physicians' offices and help them identify patients that we can assist them in helping heal.
Oh, see, and I want to add this quickly before we before I forget, but we don't have to have a physician referral to come to the program.
No, you do
You
not.
can just call yourself if you're experiencing some problems that you think
Right.
need to be checked out.
Yes.
See, that's so good.
Anything that has not healed that either you've been treating or your physician within 4 weeks,
Oh,
it's
wow.
time for you to search for more advanced wound care.
Okay.
So-
Now tell us some other than the first thing that comes to mind to me is being a diabetic, that you would have the problems, but there are other things that can cause wounds not to heal, and
Yes.
what are some of those?
Well, I'll tell you, the majority of our patients, it's as simple as just trauma. You know, they're just walking through their house and they bump into a coffee table. It makes the sore on their leg. They may have underlying issues like diabetes, or they may have venous insufficiency to where that blood's not flowing in the lower extremities. So something like that could be what starts that ulcer that just will not heal.
My goodness.
So if it's the venous stasis, they come in and the physician, you know, talks with them, finds out their family and their personal medical history,
Right.
and then they design a program for them. And the majority of the time with venous stasis, it's going to be compression. So a lot of the folks out in the community know the importance of wearing compression if they have the venous stasis, and we start wrapping those legs and putting our advanced wound care dressings on it. And
My goodness, and the chamber itself is sort of clear on the top, and we were talking earlier about how some of us are claustrophobic and it would be really tough to get over in one of those, but you said you haven't had that situation with anyone. Everybody's been...
Right, I have had patients that's came
Just
in
say
just
that.
like you, Debbie, that's like, oh, I don't think I can do this, Lori, or
Right.
Connie is our hyperbaric tech, and they say, you know, they're apprehensive about it, but we let them go in. It's a memory foam mattress. There's flat screen TVs attached to those. It's really the easiest therapy someone would ever go through. And when you think about that being able to help close those wounds by 50% faster, besides the other benefits, our patients want to come after the first 10 or 12 because they feel so great all over. Then, you know, we just really haven't. I mean, when you put in perspective that if it's a leg ulcer, you could end up in an amputation, or, you know, take a little pill, help relieve some of those anxieties and get in the chamber.
Absolutely.
Most of our patients do it.
And they do it. How does the chamber work now? I know oxygen, pure oxygen, is comes into it, but does it go into your system, or is it going on to the wound, or both, or how does it work?
Completely. It's going over your entire body. So, I mean, you're inhaling nothing but 100% oxygen when you're in that chamber.
Wow.
The ones that Cullman have are called monoplace. It's a single person in the chamber, and they're closed with that 100% oxygen. I don't know if you've ever heard of, when Caraway, they used to have the multi-place where you would sit in a room sort of like what we are. But I think the monoplace being more confined and closed, you're being able to, you know, get that 100% oxygen. It's increasing the blood flow, helping the circulation.
Oh, absolutely.
So.
Do you feel lightheaded? Do you feel any different when you when that's happening? When you're
Well, when you first go into the chamber, most of our patients say it sort of feels like you're when you're in an airplane. You know, the pressure that you get a little bit in your ears when you're going, it feels like that. And then, you know, the tech is right outside. She's talking to you about, you know, breathing, trying to get the ears to pop.
Right.
You can take in a bottle of water with you.
Wow.
So, you know, they drink that to help relieve some of that pressure. But then that travel time to get to depth of the chamber is about 10 minutes tops.
Okay.
So after that 10 minutes, literally, they're rolling over, going to sleep,
Oh, wow.
or they're watching their favorite show on TV.
Just relaxing.
Yes.
And typically, how long does it take? How long do you have to stay in? Depending on the wound, I guess.
Right. Most of the indications are going to be a 90-minute time in the chamber, 5 days a week.
Okay.
We do have some that, you know, make it in just 4 days, but really after that 20th treatment, that's where you're starting to get the benefit even when you're outside the chamber.
Okay.
So it's very important. It's a huge commitment. And again, only about 18% of our wound care patients that come through the wound care center actually do hyperbaric. So it's not everybody. I've had folks that's walked through our door that's like, I've heard I've got to come 5 days a week here for 2 hours a day, and it's not like that. Again, you know, 18% is about all that goes through.
And we're looking at an individual. What does determine if you're in that 18%? What just how bad it is, or what?
That and insurance.
I was going to say, what about insurance? Does it pay?
Insurance does have, you know, approved indications, and diabetic ulcers are, of course, one of those.
Right.
There are some insurances that will even pay for venous stasis ulcers, and we've had great success with those. So it does vary according to your insurance and your indication, but they're, you know, approving different ones every year. So I'm hopeful that there will be more indications in the future of that can utilize the hyperbarics.
That will help. And let's go back just a second and talk about venous stasis. What is that, and what causes that? I think everybody pretty much knows about diabetes, but what about venous stasis? What is it?
Venous stasis is usually something that is hereditary. Being overweight can contribute to that. Being a smoker, no activity, those type things is what contributes to it. It is a blood flow issue. A lot of times if you come into our center and you have a lower extremity wound, all of ours get a lower extremity assessment where it's almost like a blood pressure, but you do it on your leg. We're checking that blood flow immediately from very first visit.
To see.
Yes, and so if there is good blood flow, then we'll go ahead and apply the compression there, which is going to help take care of that, and we encourage elevating the legs. And that is so hard because the majority of our patients that have that are women.
Yes.
And to sit at home with your feet propped up, you know, we say nose to the toes or toes to the nose. It's hard to sit and do that. But it's very important with the venous stasis. If it is more severe, then we consult a vascular surgeon, and they go in and, you know, open up those veins to where there's good blood flow.
Oh my goodness, okay. So a person would be able to tell by, is it on the top, bottom side of their leg, or how does that normally?
Most of them are from the knee and below, from between the ankle and the knee actually, for venous stasis. And again, like I said, the majority of them are, they bumped into their coffee table, they've got this ulcer, it's not healing, they come in, we do something like that lower extremity assessment, and we identify that they have some blood flow issues. So,
all right, well, it's just such a comfort knowing that this program and this department is here at our hospital here at CRMC, so hopefully none of us will need it, but you never know. And like you said, so what do you plan to do this week? Anything? I mean, do we need to be looking for you, or are you going to do special stuff?
Well, we are, of course, going to put some advertisements in the paper and in Facebook because of social media is a big hit. I'm going out to the local physician's office and trying to help identify with them some of their patients that would benefit from wound care.
Right.
I don't think people realize the importance of it's not just the wound.
Right.
So they do have to control their blood sugars. They do have to make sure that they're eating a good protein diet.
Exactly.
And so those kind of things we help assist with. But if someone comes in and their blood pressure is elevated or their blood sugars, we send them back to their primary care physician. So once they're referred, we do not take over their complete care. We're taking care of their wounds. The physician is still very much involved.
Yes, everybody stays
as well
involved,
as you know, dietitians and So it's a multidisciplinary approach to taking care of these wounds. But
Absolutely.
it's been so rewarding, Debbie. I would love for you to come.
We need
Wish
to
I
do
had
that.
brought some patient progress, you know, just some of their satisfaction results. We have
You've seen a lot, haven't you?
We have, and our heal rate is 95%.
Wow, that's
and
wonderful.
Our median days to heal is about 24 days.
That is so wonderful.
So you think about these people that's had them for years, and within 3 to 4 weeks, we're assisting getting them healed. It's
a
very
blessing,
rewarding.
isn't it,
Absolutely.
for you, and such a reward and blessing for them too. Now, if you're going to the back of the hospital, you take a right. If you're going up toward the outpatient, parking or drop-off is where you are. Is that correct?
Absolutely. That is where
All right,
we are.
so you just park in that area and come right in. Give us a number where you can be reached.
It is 256-737-2980.
All right, Lori, always good to see you. Thanks for what you're doing too
Thank
for
you. I appreciate
the
it.
community. And of course, Lori Strain with us this morning, Director for the Wound Care Center at CRMC. If you have any questions, they'd love to hear from you. We'll be back with more right after this.